Today, the topic of discussion in the PEDS file, soft copy page number, Laryngomalacia. A child with a noisy breathing in the prone position decreased. So noisy breathing was in the supine position. With changing the position, it would decrease. When the child is in the sitting, the mother is worried about what? Why is she worrying about? Yes. What is this? This is spasmodic proof. What is he suffering from? Yes, PEDS. Any person from the PEDS. Noisy breathing. First indication. Noisy breathing in the supine position. It means they are giving you a clue that baby is having laryngomalacia, narrowing. Then being clinician, what would you do? You would first look for the any kind of feeding and the sleeping habits. First of all, you would rule out the physiological regarding the feeding habit, regarding the sleeping habits, okay? And then you would ask the mother about the diet, about the weight loss, about the GERD, about the recurrent chest infection, poor weight gain. So, child maybe the baby would be of the 6 months, 7 months with the noisy breathing, laryngomalacia, baby on the bottom feet probably. And what would you counsel the mother that by the age of 1 year, once he'll be able to sit, to walk, to eat independently, then he will get better. Pediatric male patient with the sign of laryngomalacia. What is the treatment? Okay, pediatric patient, especially if the age is less. So you would do nothing with the laryngomalacia. What is the commonest cause of, by the way, laryngomalacia? Yes, laryngomalacia. Generally, is there problem with the anatomy, with the structural problem, cartilage or muscles? Yes.
Softening of the larynx.
Hmm. So basically, the baby would not be able to maintain a specific tone of the laryngeal muscles. So in the upper way, there would be obstructive signs. That why the baby would be having noisy breathing. So you would reassure the mother and you would observe or wait for the 1 year. And laryngomalacia will resolve within the 2 years of the life. How? Yes, Fatma?
Yes, ma'am.
Hmm? Laryngomalacia, typically when it is related to the child feeding and the sleeping habit, we would tell the mother that it would resolve, it would go by the age of 1 to 2 years of age. Okay. But if the baby would be having severe symptom means what? Due to the bronchospasm, the laryngospasm, baby could have the cyanosis, severe difficulty in the breathing. So we have to keep an eye. Otherwise, you would tell the mother, wait for 1 to 2 years, it would resolve on its own. Laryngomalacia, what will you do? Nothing. You would again counsel the parents, it would resolve by its own by the age of 1 to 2 years of the life. No problem if there is 2 years or the more accurate. Okay. Infant with the airway obstruction that increases with the supine, decreases with the prone position. Laryngomalacia. See, they are giving you direct clue that it is regarding the patient baby's position during the sleeping. Noisy breathing in the supine with the prone decreases. Laryngomalacia. Baby has breathing sound in his age of 3 months. You would counsel again that it would disappear by the age of 1 to 2 years. A typical case of laryngomalacia dyspnea worsen when the patient is in the supine and gets better when baby is in the prone position. In the supine, it would be, there would be drooping, there would be more noisy breathing. Baby crying when change the position decreases again laryngomalacia. Same question, laryngomalacia. A baby develops shortness of breath, wheezing, and the doctors start to giving the bronchodilators. This is the same question we have done in the adults in the respiratory physiology, that if the adult was having the shortness of breath and you were suspecting bronchospasm, you given the bronchodilator, still the patient is not responding, and there is a breathing difficulty, there is a sound, wheeze sound, then you would have to explore or exclude out the problem with the larynx, with the vocal cords. Now, this is the pediatric case. Baby has developed the shortness of breath, wheezing. Doctors start to give the bronchodilator, but then there is no response. They was thinking about the laryngomalacia. What is the best test you would go for? Yes, the first initial investigation we have to go with the flexible laryngoscopy. If not in the choice, go with the bronchoscopy. Otherwise, the investigation of the choice would have to be laryngoscopy, flexible. Otherwise, go with bronchoscope. Laryngomalacia, how would you investigate or diagnose? Through the laryngoscope. Tracheomalacia on the children. What is the diagnostic image? Okay, tracheomalacia. क्या diagnostic sign आता है bronchoscopy पे? And what do you mean by the tracheomalacia and the laryngomalacia? How would you differentiate? Hmm? In the tracheomalacia, the cartilage of the airway, the cartilage of the trachea, it would be very weak. It would be very weak, and there would be tissue that would be having low tone present below the voice box, vocal cord. Okay, and in case of laryngomalacia, it would be above the vocal cord. So, they both would involve the airway. It would affect the respiratory. In both cases, there would be noisy breathing. Baby is having barking cough. Maybe there would be sign symptom of the nasal congestion, sore throat. So they would give you clue about the barking cough. Baby is having croup, parainfluenza virus. What is the sign of the croup? Croup sign on the X-ray. Steeple sign. Please write it down. Steeple sign. In case of the croup, there would be a stipple sign on the X-ray. How you labeled it as a stipple sign? Because it would be like inverted V. Inverted V. There would be narrowing of the airway just below the vocal cords. Physical examination finding in the croup, patient was having nasal congestion, barking cough. Again, this is a case of the croup. Baby would be having inspiratory stridor. Inspiratory stridor with the subglottitis narrowing. A child, what is the management of the croup? We have discussed yesterday. First of all, you would inhale with the epinephrine. If still not responding, give a second shot. If still not responding, now you would go with the steroids. A child with the inspiratory stridor barking cough, your diagnosis is croup. Laryngotracheobronchitis is another name of the croup. Barking cough, respiratory distress, inspiratory stridor, croup, positing pathogen, parainfluenza virus. Barking cough, what will listen on the auscultation? There would be inspiratory stridor due to subglottitis narrowing. Management of the croup. First of all, inhale the epinephrine, no response, repeat it, no response, give the steroids. Croup classic case, barking cough. They are now asking about the pathogen, parainfluenza virus. Child is having barking cough. Croup. 3 years old patient with a history of the mild atopic dermatitis, presented with the barking cough and the stridor. What is your diagnosis? Now, patient is mildly atopic dermatitis with the barking cough and the stridor. It means there is a bronchospasm, even in response to allergen. There would be spasm. Baby would present with the spasmodic group. There would be bronchospasm, then it would relieve, then it would come. So there would be go and back cycle. Kid with the inspiratory stridor, mild respiratory distress, hoarseness of voice, barking cough. Which of the following is the concerning? In the group, the risk factors, the commonest concerning alarming sign would be cyanosis, blue lips, hoarseness of the voice in the group, inspiratory stridor due to the subglottitis, narrowing stenosis. True patient given epinephrine and after 30 minutes the symptom came. Again, what would you do? You would repeat the second dose of epinephrine. Group given epinephrine twice. What is the next step? Give the steroid now. What is the sign of the group on the X-ray? That is steeple sign, inverted V. Fever, severe sore throat, high-pitched sound when breathing in the stridor, difficulty in the breathing, painful swallowing, there is drooling, anxious, restless life, feeling better with the sitting up and the leaning forward. What is your diagnosis? Yes. Again, baby is having what? Inspiratory stridor. What is the group? Laryngotracheobronchitis, epiglottitis. Yes. How would you see the baby is having epiglottitis? ग्रुप में एपिग्लोटाइटिस होता है जी.
Group is different, epiglottitis is different, ma'am.
Inflammation of the epiglottis. Yes.
Group में barking cough होता है, ma'am. Epiglottitis में
yes,
there will be a constant cough.
epiglottitis is the separate entity. And remember the typical features of the epiglottitis. 4 Ds. Dysphagia, difficulty of the swelling, they mentioned. Dysphonia, hoarseness of voice. Drooling, drooling of the saliva. And the last one is the distress of the respiration, respiratory difficulty. So these are all mentioned here. Look as drooling, dysphagia, stridor, that is an indicating distress in the difficulty, anxious baby. So it would be a case of epiglottitis. How would you treat and how would you differentiate between the epiglottitis and the croup?
Ma'am, there will be the thumb sign in the X-ray.
Yes, thumbprint sign in the X-ray. That is the diagnostic sign. Since I've said that the croup is inflammation due to the parainfluenza virus. ऐसे कहा था ना? And epiglottitis is an inflammation of the epiglottis. Virus could be involved in the epiglottitis. Virus could be involved in the epiglottitis. So what is the causative pattern? Haemophilus influenza is the commonest virus. Parainfluenza for the croup and the Haemophilus influenza, especially type B. Haemophilus influenza type B. That is the causating pathogen of the epiglottitis. Yes. What would be the treatment of the epiglottitis? By the way, epiglottitis is an emergency. Is an emergency. Yes.
Ma'am, intubation.
If the baby is having severe bronchospasm, so you would have to, after doing the ABC, intubate the patient. Intubate the patient. Drooling saliva, dysphagia, distress of the breathing, epiglottitis. Thumbprint sign, epiglottitis. दूसरा thumbprint sign abdomen पे आता है, वो किसका होता है? पढ़ चुके हैं हम. Thumbprint sign in the lateral chest neck X-ray. That is diagnostic of the epiglottitis. Yes, thumbprint sign. पढ़ चुके हैं यार. एब्डोमिनल एक्सरे पे किसका आता है? इस्कीमिक कोलाइटस. Ischemic colitis. Thumbprint sign in the abdominal X-ray, diagnostic of ischemic colitis. Thumbprint sign in the lateral X-ray of the neck, that is diagnostic of epiglottitis. A child with the fever, shortness of breath, drooling, your diagnosis would be epiglottitis. What would you do? Intubate the patient. Intubate the patient. Since I said that it is an emergency, you would admit the patient in the ICU. You would involve the anesthetist. You would involve the ENT. So multidisciplinary team would be alert. Child preschool age has the VST 2 mm. So size is small. Patient is asymptomatic. What will you do? Nothing. Just observation. Nothing is required. A child have the VST asymptomatic, nothing to do. Observation is required. Watchful waiting. Infant having meconium aspiration, how would you manage? First of all, go with the surfactant lavage. Surfactant lavage. If not responding, then ventilatory support would be required. Definitive treatment in this severe case, you could try this nitric oxide. Meconium aspiration syndrome, MAS. The newborn will need immediately treatment to remove the meconium from the upper airways. After delivery, the doctor will immediately do the suction of all the passages of the airway. If baby is not breathing, not responding well, then you may have to intubate the patient. Okay, to do the suction with the fluid that would be containing surfactants. That is called surfactant lavage. Suctioning may then continue until no meconium is seen in the material removed. Oxygen therapy to make sure that enough oxygen is supplying, and the use of the radiant warmer to help your baby maintain the body temperature. Antibiotic. Ampicillin, gentamicin, just to we give to the patient prophylactically to prevent the or treat an infection. If the baby is not responding to the treatment, then the ventilatory support may require. Now look at this explanation. Pediatric patient has fallen from a tall building. Now presented to ER with the shortness of breath, right chest pain, investigation showing multiple fracture at the multiple sides of the body. X-ray showing the right pneumothorax with mediastinal shift. What would be your management? Your diagnosis is what? Shortness of breath है, pain भी हो रही है, and right pneumothorax with mediastinal shift. Baby is having, or the kid is having tension pneumothorax. Tension pneumothorax. How would you manage the patient? There would be a time. Either you would go with the thoracotomy or thoracostomy. Thoracotomy and the thoracostomy. Yes. Who would tell me? We have discussed it in the adult. Thoracostomy, you create a small hole to place a drain tube in the space between the lung and the chest wall. Okay. And thoracotomy is a surgery when you give an incision to go and have an access with the chest and the lung. And this would help in removing either the part of the lung or the, for example, somebody is having a mass effusion pus in the lung, you would go with the thoracotomy. And needle thoracostomy, needle aspiration, needle decompression is indicated in the tension pneumothorax. Where would you place that needle? Which intercostal space you would do the needle decompression? हाँ जी, शाबाश, सब भूले हुए हो. Second intercostal space in the mid-clavicular line. Many a times we have discussed, yes. A child with the erythema marginatum, knee pain, fever, joint involvement, rash, nodules, fever, case of rheumatic fever. What is the investigation? ECG. If you see that baby is having rheumatic heart disease, what would you see in the ECG? What are the ECG findings? You have to look for the arrhythmias. You would see for the rhythm. What about the hypertrophy, right axis, left axis deviation? Because there would be damage to the heart muscle, there would be abnormalities. Viruses. A child presented with the ulcers on the mouth and the gingiva, erythematous based and the pale in the center. What is your diagnosis? Again, a typical case of the Coxsackie virus. Coxsackie virus. क्या करता है Coxsackie virus? What is this? The ulcers inside the mouth and the erythematous based. Complex spots. Because in the measles, baby would be having vesicular rash over the body and there would be a complex spot or the white spot inside the mouth. Yes. Yes. Coxsackie virus कैसे कर रहा है ये? Coxsackie virus is a notorious virus which could damage, which could affect the hand, foot, mouth, जिसको हम कहते भी हैं hand, foot, mouth disease. There would be painful blister, rash, especially in the throat, on the tongue, on the gums, soft palate, hard palate, palms of the hand and the sole of the feet. Rash on the face, inner part of the cheek, there is a white spot. This white spot is the complex spot. Rash, vesicular rash, starting from the, कहाँ से measles की rash start होती है? From the trunk. Yes, measles की rash कहाँ से start होती है? शाबाश.
Ma'am, it starts from the face and toward the trunk and to the extremities.
Yes. Okay. And especially there would be a history of previously maybe congestion, coryza, sore throat, conjunctivitis along with this picture. And on examination, when you pick the complex spot, your diagnosis would be 100%. A 2-year-old child not vaccinated and had fever for 3 to 4 days. Rash appeared on examination. There was a white spot in the mucosa membrane. Complex spot. This white spot is complex spot. Your diagnosis is measles. Pediatric patient with the coryza, with the conjunctivitis, white spot, coryza. That is measles. Measles should mention the 3 C's, coryza, conjunctivitis, coughing, and the complex spot. A child with the onset, with the sore throat and the coryza, come and go with the difficulty swallowing food. What is the investigation you will order? Sore throat with the coryza since 2 days. Now baby is having difficulty in the swallowing. You would ask for the lateral neck x-ray. Why? Coryza is for the 2 days. Coxsackie virus. Yes. What would you see on the lateral neck x-ray? Yeah. In the lateral neck x-ray, if you are suspecting that baby is having epiglottitis, you would rule out the thumbprint sign. A child with the fever, conjunctivitis, coryza, wheezing, tachypneic, what is the optimal treatment? Baby is tachypneic. There would be distress. You would check the oxygen saturation and apply the oxygen mask. and you would manage it symptomatically. Viral infection, symptomatic management. Child with the acute onset of the fever, coryza, sore throat, difficulty swelling. So again, it would be more going in the favor of, yes, epiglottitis. Go for the lateral neck X-ray. Same question. Fever and the cough. Mucopapillary rash in behind the ear and the face and the trunk. Fever and the cough, so coryza was there. Maculopapular rash behind the ear, now face and the trunk. What would we see? Measles or rubella?
Ma'am, measles, sir.
Why? Why?
Ma'am, because there is mycopapillary rash and there's evidence of previous fever and cough, so probably the cause was probably the flu was there.
Okay. Anybody else? Yes. रुबेला की रैश कैसी होती है जी? मीजल में तो आपको पता चल गया कि फेस है, ट्रंक पे है, कॉप्लेक्स स्पॉट होगा. रुबेला के अंदर देयर वुड बी पेनफुल lymphadenopathy, number 1. There would be rash. That rash could be on the face, that rash could be behind the ear. और रुबेला में टिपिकल स्पॉट्स होते हैं, उनको क्या कहते हैं? फॉर्शिमर स्पॉट्स. फॉर्शिमर स्पॉट्स. Again repeating, फॉर्शिमर स्पॉट्स. A 7-year-old unvaccinated boy presented with a red erythematous irregular patches rash that is around the neck and spread down his back. What does he have? क्या है जी? मीजल्स है कि रुबेला है? हाँ जी बोलो, शाबाश, सब सोए हुए हो?
Ma'am, it could be rubella.
रुबेला. ओके, मैंने एक हिंट दिया था प्रीवियसली, हम जब कर रहे थे कि जब भी रुबेला का होगा, हम स्टिल बर्थ और काफी कॉम्प्लिकेशन से बचने के लिए बिफोर प्रेगनेंसी वी एडवाइज दिस रुबेला. ठीक है, रुबेला. Who would tell me what is the typical rash of the rubella? Rash would be red or dark pink. Okay. And
Ma'am, it would be irregular.
there would be patches. It would be more like the raised bumpy or the rough rash. There would be painful lymphadenopathy. The rash would be more specifically in the neck, behind the ear. So then you would see the baby or the child is having rubella rash. A child with the runny nose, now congestion के symptoms are हैं. Fever which subsides and then rash appears all over the body, starting from the face. Yes, we know that the rubella rash appears after 2 to 3 weeks. Rash would take 2 to 3 weeks to appear after the baby get infected with the rubella. Runny nose, fever and the rash. Yes.
Ma'am, it sounds
क्या
like
होगा?
measles.
Yes.
Measles. Measles.
Measles. हाँ जी, फातिमा. Is Fatma with us?
No, ma'am. Yeah, Dr. Fatma is not with us.
Okay, okay. Yes. इन्होंने लिखा हुआ है रोसिएला रैश. What is रोसिएला रैश? This is the rash due to the human herpes virus. Herpes virus की भी strain 6 है, ठीक है? Herpes virus की भी strain 6 है, and that's why it is also known as 6 disease. ठीक है? 6 disease. And this is the commonest disease and the commonest infection that occurs before the age of 3. That's why they have mentioned here. Roseola or herpes 6 virus rash, 3 days of the fever, then resolved completely, and after the infection resolved, then the rash appears at the trunk and the periphery. Once the rash starts, no more fever. Diagnosis is completely clinical. Treatment would be the symptomatic treatment. Fluid, antipyretic, acetaminophen to reduce the rash. A baby, that's why they said fever which subsides and then rash appears. That's why your diagnosis would be Roseola. A baby with the white eye reflex. White eye reflex, leukorrhea, congenital, with the murmur. What is your diagnosis? Rubella. Rubella, congenital heart disease, congenital problem, congenital cataract. The notorious pathogen is always rubella. Absent red eye reflex, that is physiological. If we all check after immediately delivery red eye reflex, then we